Good morning. Good morning. Welcome to our state legislative forum. This is an event sponsored by, hosted by City and State. And of course, I want to thank, first of all, our sponsor, AARP New York, for co-hosting and for sponsoring here. I also want to thank everybody watching on Zoom, Facebook, and particularly welcome to our listeners on WBAI Radio. I believe that we are actually streaming live on the radio. So thank you all who are tuning in there, and I will make sure to shout out names of all the legislators who will be speaking today ahead of time, so we know who you're talking to or who you're listening to. But it's a very important time in state politics because there's 3 weeks to go until the end of the legislative session. This is traditionally when things start to get really busy. Of course, things have been moving quite a bit this entire year. It's been a year unlike any other. But I'm really excited to check in with legislators from the Bronx on what their remaining priorities are for the legislative session. There's 3 weeks left, and this forum gives us a chance to hear about the top policy priorities, and we're going to hear about topics like COVID-19, high prescription drug costs, retirement security, long-term care reform, hate crimes, parole reform, and how to make housing more affordable, and whatever else comes up. I don't think I introduced myself. I am senior reporter Jeff Colton with City and State. I'm hosting today, but we're going to hear most of all from our panelists, which I will run through very quickly. That's State Senator Luis Sepulveda, State Senator Alessandra Biaggi, Assemblymember Chantel Jackson, Assemblymember Amanda Septimo, Assemblymember Jeff Dinowitz, Assemblymember Karines Reyes, and from AARP New York, Associate State Director Kevin Jones. So welcome to all of our panelists. Thank you all so much for joining us, all Bronxites. So we're talking specifically about the borough here. And you know what? I already see some questions popping off in the chat. I just want to say thank you. Please keep that going. I'm trying to pull some questions. However, if you have a question, please put it in the Zoom Q&A so I can look through those. And if you're looking yourself, please upvote your favorite questions so we can get to those later on. I really want to ask legislators questions from the audience. But look, for now, let's jump into the first hot topic, and that's recovering from the COVID-19 pandemic. Literally this morning, I downloaded my Excelsior Pass, my app on the phone, because I have Yankees tickets tonight. I'm really excited. It's my first big event in New York back after the pandemic, and it happens to be in the Bronx. So, you know, good timing here. Pretty excited about that, going to see the Yankees play the White Sox. But I want to open this up to all of our panelists. We'll go along one by one. And I just want to say that the city, you know, officially reopened this week. You know, of course, things have been happening, action's been taken, but we hit a milestone for sure. And I just want to ask, what are any concerns? Are there any concerns in your eyes as state legislatures? Anything that you think still needs to be addressed as the city moves towards going back to you know, a post-pandemic time? So we will, well, you know what? I'll open that up to whoever is ready to talk. So by all means, jump in.
Well, I think that all of us have to be concerned still, even though COVID's under control and well, somewhat under control, and we're at our positivity rate is a little less than 1%. There's still the issue in our county where we still lag behind other counties in terms of vaccination rates. What we did early on, at least my office did a program called the Vaccination Wait List, where at this point we're responsible for vaccinating over 2,000 people. But now there's a resistance of people going to the providers. So we have to shift tactics, and that's what we've been trying to do. So we're taking the pop-up sites throughout the district, at least throughout my Senate district, to make sure that we go to high traffic areas, foot traffic areas, shopping centers, schools, train stations. We recently had 180th Street Station as a pop-up center where the number of people that were vaccinated was decent. We need more, but the concern that I have now is to make sure that the resistance to getting vaccinated, the fear, is overcome so that we reach a number where ultimately leads us to herd immunity.
Yeah, and I'll just add to what Senator Sepu was saying that we're noticing that in my district, a lot of people have resistance to the vaccination, and it's a specific group. So it's like the millennials, the Gen Zs. They're more resistant to it, and so I've been having conversations with the mayor's office around how to get the appropriate information to them so they can be more comfortable with the idea of it. And so we've been working on, like, I see the Yankees are giving away tickets for vaccinations, but other incentives that would help people, one, be a little more comfortable with it. So education wise, one, but also if we can incentivize people, that's an option. So for young people, we were talking about like maybe Foot Locker vouchers, and for maybe the millennials, more like supermarket gift cards, things like that. So we're running the gamut, and I'm continuously having community events where the information will be provided, but the vaccine and the testing will be provided as well. But our small businesses are suffering here in the Bronx, so that's something we also need to be having conversations around.
Yeah, and Jeff, I forgot to add the issue of food insecurity as well. It's a major problem here in the county, and we're going throughout giving out food. I just want to plug an event we have today at 4 o'clock at 890 Garrison Avenue, where we're going to give out about 1,200 boxes of food. So that's something also that I'm very concerned about, the level of food insecurity in this county.
It's really unfortunate that people have to be incentivized to take a vaccine that'll save their lives, but the reality is that many people do. But the truth is, we are never going to achieve herd immunity until even people kids who are 2, 3, 4 years old are vaccinated. In order to achieve herd immunity, you have to have a high enough percentage so the virus cannot be transmitted. And if people 12 and up are mostly vaccinated, that's still not enough, because the virus will find a way to spread if there are people to whom it can spread. So we really have to hope that on the federal level, they will approve the vaccine for even younger people than currently can get it.
Yeah, I have to agree with Jeff on that. And vaccine hesitancy has been, I think, the biggest challenge that we've been trying to address. But since its approval of children that are 12-year-olds and older, I think it's important that we also start to communicate with parents about getting children vaccinated, because it affects everybody when you have a population within our communities that just aren't vaccinated. My son's getting vaccinated on Saturday, so I'm very happy about that. And also, I think what I've been hearing from a lot of folks that are hesitant about the vaccine is that, well, I'm not going to get it until I'm able to get it from my own doctor. So making sure that primary care providers also have a stock of vaccine that they can start administering to their patients, perhaps would ease some of that hesitancy so people feel more comfortable with their own primary care provider being the ones administering their vaccine. And also, I think we have to deal with the economic impact of COVID-19 as we reopen. There are folks that are being asked to go back to work and are concerned about having to go back to the offices. A lot of our small businesses have closed. I think those are all issues that we have to contend with as a city and as a state.
And I agree with everything that's been said. And I think another kind of point of concern beyond the hesitancy around the vaccine is truthfully the kind of honor system approach that we're taking in going maskless from a public perspective. As much as we want to give people the time and space to feel comfortable with the vaccine, get vaccinated, and move into the space where you can walk into a room and comfortably assume that everyone who has their mask off has taken this step to be responsible, that's just not the reality. We've seen lots of issues with mask compliance throughout the pandemic. And so I think we have to think critically about how we balance reopening and giving people the space to go back to whatever normal will feel like for them beyond this pandemic. But also be responsible and acknowledge the fact that from a public health perspective, an honor system is just irresponsible.
I'd have to agree with Assemblymember Septimo, and also just say that one of the really important pieces of recovery includes moms and caregivers. And so I've been focusing on something called the Marshall Plan for Moms, which is really a federal initiative that is taking place and essentially asking for 4 things, some of which Newark has already done, but direct payments to moms, which is actually something that President Biden has actually announced he will be doing in the coming months. Things like paid family leave, affordable childcare, pay equity, again, things that New York has already done. But then also because we've lost over 1 million women, significant number of women of color who've left the workforce during COVID-19, we need to have retraining programs to make sure that they can be able to enter the workforce again. And also to have a real plan that is not one that is notifying the families a week out about opening schools safely for 5 days a week. So I look forward to that too. At the state level, we have a bill to create a task force, and the goal essentially would be to do that in all 50 states. And the reason for that is because every state has different progress. And so to be able to have a framework that we know would achieve allowing for moms and caregivers to enter back into the workforce, but also to have the support that they need, is an important part of our recovery during COVID.
Follow up on this topic too. We mentioned small businesses. Right now, of course, the state, the city, various regulations are doing it. They're attempting to balance public health with a desire to get people back out shopping, back out to restaurants as much as possible. Economic recovery with health recovery. Wondering how you think the state and the city government are doing balancing these issues right now, particularly when it comes to indoor capacity regulations, that sort of thing. Are we erring too far on one side, or is it striking a healthy balance?
I think we have to be mindful of when we're being critical of our agencies. It's not like we've done this before, right? So we're learning as we go. We should be listening to all the experts in these different areas. I feel like it does. Some of it doesn't make sense to me, like why we would have like restaurants and gyms open, but we aren't opening our senior centers. Like some of the things just don't add up for me. But I think I want to be very mindful of being critical of these governing bodies, because it's not like we've done this before and we have a blueprint. We are creating the blueprint as we go.
The only thing that's concerning is that you get mixed messages. And this is really a byproduct of the lack of information still that's available about the virus and about how it can be transmitted. The lack of information on the variants, because sometimes, even though recently they've indicated that I believe it's Pfizer and Moderna do protect mostly against the variants. But when we don't have the information and we have conflicting information, so people will go into places with masks and others aren't. And I agree with the Assemblywoman about the inconsistencies about the locations where you can have full capacity and not full capacity. So look, I'm going to rely on the CDC, generally speaking, when I advise my constituents. But certainly we have to do a better job of bringing a single message, a less confusing message, so that people start to adapt and adjust, and businesses can start to adapt and adjust.
On the state level, we have taken action. My legislation for the eviction moratorium for tenants and the foreclosure moratorium also helped small businesses. I believe everybody on this panel supported that legislation, and that's really very important. I just came from a meeting in my district at a restaurant. The other people were sitting inside, and I said, I want to do this outside, because I don't personally feel comfortable going maskless indoors unless I know for a fact that everybody is vaccinated. But I think we do have to do more. But I think Senator Sepulveda is right. There's mixed messaging between the governor and the mayor, and all too often they are not on the same page, and that really is very unhelpful in trying to move forward.
I think what Assemblymember Dinowitz said is really important, because a lot of folks that are vaccinated still are very nervous, and they're still experiencing isolation and different challenges like that, particularly the 50 plus, who was hit the hardest in terms of age demographics by this virus. But the vaccine hesitancy problem isn't just for the folks that are hesitant to get the vaccine. It keeps a lot of other folks too nervous to interact and get out and about as well. And that has an impact on the people that are already vaccinated as well.
No, it does. But again, it's really the messaging that's the most critical thing. We have to do other things, obviously, to get our small businesses back in order. We just allocated I believe it was $2.2 billion for small businesses. I'm sorry, $800 million for small businesses and $200 million for entrepreneur programs that will help these small businesses get in a position of getting grants and low interest loans from the state and the federal government. Because what we're seeing here in the Bronx is that less than 4% of small businesses were able to get access to that kind of capital, to those grants. And the primary reason was because they just weren't prepared for it. They didn't have the correct bookkeeping, tax statements, and things of that nature that allow you to access this capital, these grants, and these loans. So one of the things that we really have to focus on is putting our small businesses in a position where they have the correct bookkeeping so they can get access to this funding. There's a lot of money that we need here in our small businesses in the Bronx because it's really the backbone of the economy in most counties in the city of New York, but especially here in New York, and the backbone for the immigrant community, because about a third of our small businesses are owned by the immigrant community. So we have to do everything we can possible to get them access to the capital so that they can continue to thrive and bring in more businesses, more jobs. Because even before the pandemic, we've had the highest unemployment rate in the county. We've had it for years now, no matter what's happened and what we've tried to do to change it. We're still dead last in terms of unemployment and other factors that we're still dead last on, no matter what we do, including health and the lowest graduation rates. So a lot has to be done with health, graduation, but a lot of it is dependent on the biggest social factor is the issue of developing the economy of the county so we can eradicate poverty and take care of a lot of these issues that were brought to the forefront by COVID.
Now, shifting here, I want to talk about a bill that I know AARP big supporters of, and I believe this is actually sponsored by Senator Biaggi, so I'll definitely have you respond first to this. But I want to talk about this bill to curb high prescription drug costs, specifically this bill that's proposed to prohibit so-called pay-for-delay agreements between brand name drug manufacturers and generic drug companies. My understanding is that that's still very much being considered before the end of session. Hoping Senator Biaggi could give an update and the others could talk about, I don't know, whether they like it or not.
I would be happy to do that. So for those who don't know, so there's a bill that is currently pending in the legislature. The number is actually S4370, and essentially it's a pay to delay ban. And so what the law would do if passed is ban this industry practice that is really disgusting. There's really no other way to describe it. It's very unfortunate that this exists, but also not surprising that this exists because, as we know, the pharmaceutical industry is very much rooted in profits rather than healthcare, which is ironic, but nevertheless. So this bill essentially would ban the practice of pay for delay agreements where these very large pharmaceutical companies pay or incentivize a competing company to keep generic or often cheaper drugs off of the market. And so the brand name drug manufacturers compensate these generic drug manufacturers for keeping its product off the market for a certain amount of time that's agreed upon in the contract or agreement that they sign. And so why these agreements are problematic, even though I probably don't have to say why, because it's incredibly obvious, is because when they involve the first to file generic manufacturer, no other generic manufacturer can enter the market until the first to file manufacturer has actually marketed its product for 180 days, which is a significant amount of time. And frankly, these financial benefits for drug manufacturers are at the expense of consumers in a way that actually could be the difference between life and death for many people. And so there are civil penalties in the bill that are set forth. There's a whole bunch of other things, but a really noteworthy finding, and then I'll stop, is that the FTC has actually found that the pay for delay agreements really prohibit generic entry for an average of nearly 17 months longer than the settlement agreements actually account for. So that's another probably intended consequence, even though I think that you could probably say on the face of the agreement, it's an unintended consequence. We can not afford to do this any longer. And so we know currently, last thing I'll say, is that consumers essentially are paying 85% higher prices than the generic drug counterparts. And so we have to allow for free market when it comes to prescription drug costs, especially in places like the Bronx and the 5 boroughs, where we know that people, again, are struggling probably the most, not just in New York, but in the entire country as a result of COVID. And one of the reasons why is because of the lack of access to healthcare. So if we make it harder for people to get the drugs that they need to survive, what we're doing essentially is we are cutting people's healthcare off and also really affecting their lives. And in many ways, we can probably argue that there's a direct line drawn to their livelihood and the longevity of their life.
I just want to hop in and
Senator
say,
Biagi's legislation is a great piece of legislation. But, you know, we know that the ultimate move that would curb prescription prices immediately if we allow a single payer system where the federal government through Medicare can negotiate drug prices. I mean, that's going to be the transformative process. Unfortunately, the Republicans in Congress are preventing that, so we have to continue to push our federal representatives. But as an offshoot of Senator Biagi's legislation, one area I'm looking at myself is the amount of litigation, lawsuits that these big pharmaceuticals bring against these companies that create the generic brands. I mean, one particular company had spent over $50 billion essentially attacking these manufacturers that produce the generic drugs to keep the generics off the market. Again, Senator Biaggi has a great bill, but I'm going to be looking at that component that deals with litigation and the types of frivolous litigation that these pharmaceuticals are bringing to keep the generics out.
I think this is very good legislation. It unfortunately hasn't moved yet in either house, but I'm hopeful during the last few weeks that it can move in both the Senate and the Assembly. But I think ultimately, if we're talking about anything to do with health, we need to pass the New York Health Act, which doesn't conflict with this bill or anything. But the New York Health Act really is what we need to do. There are still many disagreements on the issue, but I believe until we pass that act, we are never going to be able to properly provide for health care for everybody in the state, and certainly we're not going to be able to do it in an equitable fashion. So that's what I believe we need to do ASAP.
And I agree with Jeff 100% on that.
I just wanted to hop in and say that, you know, I've witnessed how the delay of the generic drugs coming onto the market has proven to be prohibitive for many folks in terms of treatment. And oftentimes we delay treatment for our patients because they can't afford the manufacturer who originally came up with the drug. I also have a piece of legislation with Senator Salazar that would add prescription drugs to the list of goods that can't be price gouged. And it would allow for the Attorney General to sue pharmaceutical companies on behalf of consumers. And also a piece of legislation that I'm sponsoring with Senator Rivera, which is the opioid settlement fund, because often we've sued pharmaceutical companies, opioid pharmaceutical companies, the state has, and they have this money, but the money isn't reinvested back into preventing opioid addiction and overdose, and it hasn't been reaching the communities that have been mostly affected. So I think there are many measures that we can take to kind of curtail the power of pharmaceutical companies in our state. And of course, the New York Health Act, which would companies altogether and allow to negotiate the state pharmaceutical prices, would go a way to curb the prices of pharmaceuticals as well.
Look, while we're on the topic of the New York Health Act, I guess I'd love an update about that. We've been hearing about this for years. Of course, it would be a truly massive change to the state's healthcare system, providing a public, I want to say a public option, but I might not even be describing that correctly. So I'll turn it over to our legislators here and ask, is there a chance that this actually passes this year, or is it just another year of debate and discussion and movement building, but it will not become law in the next 3 weeks?
We are forever optimistic, and we will always fight. And I ran for office because I believe that this is the direction that our state should be going in, because I've witnessed firsthand how insurance companies have been making money hand over fist off our sick and our elderly. And we have a system that just hasn't been working. So we are going to continue to fight till the very end, till the last day of session, because we believe that it's the right thing to do.
Yeah, I think
and even with our supermajority,
86 members of the assembly have signed on. So I believe everyone on this call has signed on. We really want to see it passed, and we're going to continue to push and ask and request and advocate on that topic. But we are all in support.
Yeah, and and Senator Biaggi can agree with me. I think that during now towards the final weeks of session, there seems to be a stronger push to pass the New York Health Act, and we have a majority of members that support the bill. So I'm seeing now momentum that I hadn't seen at the beginning of session. Of course, we're dealing a lot with COVID and COVID-related legislation and the budget, but now we're seeing some movement like we hadn't seen before, and I'm hopeful that it passes, because that, along with single payer, would be transformative for our seniors and people that need the most help with healthcare.
This legislation is a generation in the making. When I first got to the assembly, and that was a while ago, we had this bill. It was in a different form, but Dick Gottfried, who's chair of our health committee, and he's actually been chair in all the years that I've been in the assembly. This is almost his life's work, and he's refined and improved the bill over the years. And I think over the years we've also seen every year a greater and greater need for this, but we have to achieve a consensus, not only among the legislators, but among the various stakeholders. And there are a lot of disagreements, but you can't be in this line of work without being optimistic. So I am optimistic, and I really hope that if we do nothing else during the next 3 weeks, that we do this.
I am so happy Assemblymember Dinowitz said that, because for all the optimism in the room that I also share a healthy dose of skepticism that we get this done this session, frankly. If we're being honest, haven't really heard much, but I would love to be pleasantly surprised. This has been, to your point, Jeff, earlier, this has been a history-making session from start up to this point. We've seen really incredible landmark legislation passed. I would love to see this added to the list, but if I had to guess, I don't see it.
Well, I think part of the problem is it's not just the legislature. We also have to deal with the governor's office. So we may have an agreement in the legislature, but he may have a difference of opinion. And I think, generally speaking, the governor has been the biggest barrier for us passing the New York Health Act.
Luckily for us, we have a supermajority, so we could override him, and also becoming more relevant by the day.
I would love the New York Health Act to be the reason we use our supermajority. I don't know that there's any better way that we could serve our communities and New Yorkers that elected us a Democratic supermajority than to use it on something this critical and important.
Assemblymember Septimo, you sound like a reporter with that skepticism, and I very much appreciate it as a journalist. And actually, could one of you, we have a question in the chat of just, can we get like a 30-second explanation or even 10-second explanation of what the New York Health Act entails? And actually, I'll throw that to Assemblymember Reyes. You can handle that one.
Sure. So the New York Health Act would create a single payer system in New York. It just means that instead of you having an insurance company that would stand between you and your healthcare provider to pay those healthcare bills, the state of New York would be the one in charge of paying the bill. Very similar to what Medicare does on a federal level, was you're a Medicare recipient, Medicare pays the bills when you go to the doctor. Similarly, that's going to be the case. So there won't be a United, a Blue Cross, or whatever. And the problem is with us insurance companies is that these are for-profit entities, right? They have leadership and executives that make millions of dollars a year. And oftentimes we skim off the cost of, we skim off the top of healthcare dollars to pay for these administrative fees that don't necessarily go to patient care or treatment. And we want to make sure that every single dollar in our state goes to taking care of our patients. And the New York Health Act would just mean that the state of New York will be the insurance provider, and through of payroll taxes, we would be able to pay for healthcare for everyone.
That was perfect. Thank you for the.
I think there's a dispute going on right now, which really points out the need for the New York Health Act. There was a dispute right now between Montefiore and United Healthcare. And as big as Montefiore is, United Healthcare is a $100 billion entity. And because of that dispute in terms of fees and how much they could charge, many people in the Bronx right now are no longer able to go to the doctors of their choices because this fight has not been settled. We wouldn't have fights like that if we had the New York Health Act. And I'm sure there are many other examples. We don't need these gigantic insurance companies running the show for our healthcare system.
And one of the biggest arguments against the New York Health Act is how are we going to pay for it, the cost. Now, I know that the sponsor has done some research, and I believe, unless my numbers are off, that it would save the state of New York annually about $400 million. So it's almost counterintuitive or adds another reason why we should pass the New York Health Act this session.
Look, we're about halfway through the event. We have a lot of topics to get to, so I do want to speed up the topic a little bit. And look, if we're talking about money going towards health insurance, another thing that many of us put aside money for is retirement security. This is another bill that I know AARP is big on. And actually, I'll throw it to Kevin Jones first to comment on this. But a retirement security bill I know is pending right now to kind of improve the state's secure choice savings program that would create a state-facilitated IRA, independent retirement account, for the private sector, basically give everybody retirement savings. So Kevin, first, if you could speak about that, and then I'd like to hear from our legislators on whether that bill is moving this session and what your thoughts are.
Yeah, no, great, thank you. So we are, as you said, we're very supportive of Senate Bill 5395. That's Senator Savino's bill, and Assembly Bill 3213, which already passed the Assembly by Assemblymember Rodriguez. The key difference, the keys to this bill is that it expands the existing program to require employers with 10 or more employees to participate, and it also auto-enrolls the employees who can opt out if they choose to. What we found is that when folks are auto-enrolled and the employers are required to do this, that you get about 20 times more participation in these retirement accounts, which is just really crucial. Because as we all know, New York City is not a cheap place to live, and it's certainly not a cheap place to retire. So, the amount of money folks could get from Social Security is not enough to retire with dignity. And we think that this bill is crucial. So we hope that everyone on this panel will sign on and support the secure choice legislation.
Well, I think it's a great piece of legislation. Not only does it help you when you retire, because whatever money you have in there will be taxed at a lower rate, because usually as seniors we have a lower rate, but you also get the tax savings while you're contributing to it. So essentially you're going to be accumulating interest on interest on interest without paying taxes until later on. And that's something that in the Bronx, you don't see much of. And as you indicated, when people know about it, 20 times more likely to participate in it. And I think if we as legislators participate in a program, we inform our communities and those that can afford to contribute to these deferred compensation plans would be great. I think another component of the economy that we have to bring into the Bronx so that people know that you have these options and they can make your life easier when you get older.
Right, and I just want to say that it's really important that this pass at the state level, because the city just passed their own version of this bill. And if the state doesn't step up and expand the existing program, what you could see is the state having a really difficult time finding a company to actually do, to contract with to do this work for the state, because the city program will take so many people out of the state pool.
This was overwhelmingly passed in the Assembly. I think what makes this effective is the fact that it's an opt-out instead of an opt-in, meaning people are automatically enrolled. If people have to enroll, most people just won't do it for one reason or another, or because they're not aware of it, they don't pay attention. But because it's an opt-out system, that's what's going to make this successful.
Actually, a quick clarification question. Would this apply to companies that already have retirement plans, or is this only ones that do not have it in place? Do we know?
No, it only applies to companies that don't already offer another retirement plan. So if as an employer, if you're already giving this benefit or providing this benefit to your employees, then this would not impact you.
Cool. Thank you for the clarification. Look, a couple other bills that we want to get to is, of course, one bill that I've actually been honestly surprised that it's been getting so much debate, so much attention, is parole justice, and talking about letting aging prisoners out of prison. It's become, of course, it's of course a very emotional debate. You know, when you're talking about people in prison, you're talking about victims. Just wondering what the status of that is, both on the Senate and Assembly level here. What are the discussions happening, and is this the kind of thing that is going to be touched upon before the end of session?
Well, I was the chair of crime victims, and I visited crime victims and corrections, and I visited about 18 correctional facilities in that capacity. The reality is that people that are 55 years or older, when released into the general population, recommit offenses at a significantly lower rate. People that have done 25 years, have been incarcerated for 25 years, really pose an unnecessary expense on us as taxpayers, because if you release, generally speaking, when you release these individuals that are older, they don't commit crime. I think the recidivism rate is less than 6%. So we have to start thinking that the concept of corrections in the state of New York is rehabilitation. The problem is that people always take into consideration the crime that the person committed. If a person committed a heinous crime, of course, that raises the level of concern about them being released. But we have to remember that when people are sentenced, the crime that they committed is already factored in. And when you go before parole boards, they take that factor in again and again, especially with this age group. And so you don't get the release rate that I think is justified by the recidivism rate. Now, I've recently introduced a bill that basically says that when you go before the parole board, their requirement that they consider the seriousness of the crime when making the decision be eliminated, because again, the crime was already factored in to the sentencing. So if we're really serious about rehabilitation, and you have individuals that I've spoken to over the years while visiting these facilities who have led a perfect life, have gotten college degrees, have been mentors to other individuals that are incarcerated, and have demonstrated their capacity to go into the general population and be productive, yet they still languish behind bars at an exorbitant cost. I mean, depending on what numbers you look at, it can cost us anywhere between $150,000 to $300,000 per person that's incarcerated to support them in the facilities. I'd much rather spend that money on giving free college education to students that live in the Bronx.
In the Assembly, the bill is currently sitting in the Corrections Committee. The bill, and I agree with much of what Senator Sepulveda said, there are some controversies around the bill. For example, should the age be 55 as opposed to some other age that people could be eligible for parole? Should the time period that they had to have served be 15 years? Should all crimes be included? Because to use the most extreme hypothetical example, if somebody committed a mass murder at the age of 40 and was sentenced to life without parole, under this bill as currently written, they would be eligible to be considered for parole 15 years later at 55. So, as I said, I agree with much of what you said, but there are people, advocating on both sides, and I think we really have to look at this because we do have to deal with parole reform. There are many things we have to change. This bill has a few steps to take in the Assembly. I'm not sure where it sits in the Senate.
But Jeff, you said something that I failed to mention, which is absolutely correct. What the bill does, you see, a lot of times the unions or stakeholders engage in incredible fear mongering when it comes to our pieces of legislation. I mean, you're seeing a lot of that with bail reform, but with parole reform, they think that if we pass this bill, that automatically a person is going to be released. And this is just offering you the opportunity under those guidelines, the kind of number of years that you've served and your age. It's offering you an opportunity to go before the parole board. It's not releasing anyone automatically. And again,
That's right.
part of that problem is us providing that information to society at large. And sometimes the unions, they get ahead of us on the messaging and engage in incredible fear mongering that's not productive for us to pass legislation that ultimately will save the state a lot of money.
Appreciate the discussion on that topic. I want to shift over to affordable housing, particularly for seniors, since we're here with AARP. But I guess one question that everyone's been wondering about lately is the eviction moratorium. I know that I believe it's currently still enacted. There's, of course, many landlords that are saying, it's time to lift it. It's time to lift it. There's others that are saying, no, we're still in the midst of a crisis. Hoping I can get an update on that. I'm not sure if any of you are on the housing committees or whatever, but just if somebody could give me basically, is the eviction moratorium still enacted until when? And do we expect it to be updated or lifted, or what's the
I hate to get hog here, but let me address it because it was my legislation.
It's your bill, Jeff.
We originally
perfect.
Well, it was. I mean, we originally passed the moratorium on December 28th, and it created the moratorium through May 1st for not only evictions, but for foreclosures, as well as a moratorium on tax liens. So it helped both tenants and homeowners and small landlords. We, at the end of April, actually at the beginning of May, we extended the moratorium through August 31st. The reason being it's still an emergency. People still haven't gotten back to work and so on. And we don't want to see mass evictions take place. We don't want to see that anytime, but particularly during the pandemic, we don't want people put out on the street. So it's extended to August 31st. But combined with that, we have billions of dollars that came in from the federal government that all of us voted to in the state budget on, and those billions are going to help people with their back rent. It's going to help landlords actually keep their buildings because they're the ones who are going to get the money. So right now we're good through August 31st. No evictions if people file the hardship declarations. No evictions through August 31st.
And the Office of Temporary Disability Assistance also is building out the program for the rental assistance, and that should be going live by the end of the month. So folks are able to apply. The landlords can apply for the tenants as well, but they're gonna they can start the process, but they're gonna need the tenants to sign some documents as well. But this money would be going to the landlords. It would pay up to a year of rent retroactively, and I think 3 months prospectively for those folks that have lost income or haven't been able to pay their rent. And we know that both tenants and landlords are struggling equally here. So we wanted to make sure that this is a program that's accessible to both, and we bring some relief to people who are struggling.
And one thing that's important to me is it's going to help one of the most marginalized groups in our society, and that's the undocumented immigrants. They'll be able to get access to help them pay for the rent. Not only that, but also through the Excluded Workers Fund, where they can use the monies to pay their rent. So it's very much all encompassing. It's helping the landlords. It's protecting them from foreclosures, both regardless if you're a state chartered bank or a federally chartered bank. We just will not allow you to commence litigation in our Supreme Courts to foreclose on properties. But help is on the way, and I know that many of the landlords are frustrated. Many of them say that people are using this as an excuse, but unfortunately, this is a health crisis, and having people in the streets during this crisis would have been catastrophic. So we are going to provide funding through the federal government, state government, that will help many of these small landlords, 10 or less units, to recover. And also we have protections on water bills and other things that we're doing to make sure that the landlord doesn't suffer, the credit ratings and things of that nature are other things that we're trying to do to help people get through this pandemic.
Want to shift over to some questions from the audience Q&A, which I very much appreciate. We have a lot of good questions coming in. A lot of people are wondering about senior centers. I know that one of you addressed this at the beginning of our event today, saying that gyms are open and restaurants and stores, but not senior centers. Wondering if any of you have been on top of this issue and if expect when will these open again? And first, also, is it good policy that they're still closed? Is there an extra concern in these locations?
Can I just start by saying I think one of the things that we could really do a better job in is just making sure that these senior centers are able to operate and provide services even in the virtual environments. Because I think one of the things we saw at the start of this is that a lot of these providers just did not have the capacity or the technology to do the outreach and to continue to serve the constituents while people were staying at home and staying distance. So I think that from a long-term perspective, that's something that we really need to look at, is making sure that service providers are able to adjust on the fly the way that they were. A lot of them were not able to, just because this was such a new collection of challenges that faced them all at the beginning of this pandemic. I think we're all very grateful to the groups in the community that stepped up and did a lot of extra work, and we're very tireless in reaching the folks that they serve. But I think the folks in government have to really make sure that these providers are able to shift over to virtual a lot more seamlessly than they were able to last time.
Well, I think what the pandemic has certainly brought to the forefront is the level of food insecurity that we have with seniors, especially because when we give out food, it's mostly seniors that are on the lines seeking assistance. Telemedicine, I think COVID has brought that again. It's going to be a major component of health services in the future. But when you have a digital divide and you have seniors that can't afford laptops or don't know how to use a phone, then we have to do a better job of making sure that we provide either free or very low cost broadband to the seniors in our community, to make sure that we provide either tablets or laptops or some way so that seniors can access these services. And we have to make sure that our senior centers, and I think as a necessity, they've learned the outreach component now of a senior center. I know that one of the directors of my senior center, she used to make, her group used to make anywhere from 300 to 500 phone calls a day to deal with the seniors, because one of the major problems as well was the issue of mental health. It quadrupled in terms of the need. And so with the COVID, with the pandemic, with COVID, we have to learn to adjust to some of the ways that we've done work at senior centers and our seniors. And we have a great opportunity now, but we have to provide the ingredients for the seniors to be able to cook when it comes to telemedicine and food insecurity and things of that nature.
I just want to plus one everything that was said already about our senior centers. That was me who mentioned the gyms versus the senior centers. And I selfishly miss doing Zumba with my seniors. So I really want them to be open. I live in Concourse Village, which we have majority seniors here, but we absolutely need our seniors to be able to socialize the same way we feel about our students, right? Like as a social worker, it's so important that social emotional be taken care of in these moments. So for me, the senior centers, one, provide resources, but that social emotional intelligence is also extremely important as we are young people and as we get older. So I really want our senior centers to open up safely as soon as possible.
Yeah, I just want to say that emotional well-being is about quality of life as well for our seniors. And I think a part of this reopening is like everybody measuring the amount of risk that they're willing to take after they're vaccinated. Do they wear a mask? Do they not wear a mask? But I think that within the confines of a senior center, we can open up safely, like we can provide for social distancing, ensure that everybody wears a mask, make sure that we provide vaccines for them so those that haven't gotten vaccinated can get vaccinated. But I think it's time, because the reality is that our seniors, they may not be going to their senior centers, but they're doing everything else that inherently puts them at risk, right? They still go to the doctor and sit in a doctor's office. They still go to the supermarket. They still do everything else that they were doing prior. They're just not being able to go into their senior centers. And I think we can open them responsibly with the vaccination rate that we have now, with the resources and the information that we have on hand. We can absolutely do it. We just have to be mindful and provide our centers with the resources to protect the seniors and also continue to provide services.
Yeah, one statistic that I heard that really jumps out that I wanted to mention is that isolation can be as damaging to your physical health as smoking 15 cigarettes a day. And so, obviously the services provided by these centers are very important. I want to give a shout out to Assemblymember Reyes for her bill that would allow SNAP recipients to use benefits to purchase prepared meals, by the way. We were very supportive of that because we know food insecurity was a big part of this, but also for a lot of these organizations, these are wellness checks for people, right? Whether they're delivering food or whether people are actually showing up at the centers to pick something up or to interact, that's a first line of defense for someone that may need a little extra assistance in one area or another. So.
Thank you, Kevin. Yeah, so the bill that you mentioned, we were able to pass it last year. It didn't move in the Senate. It moved in the Senate this year, so we're moving it in the Assembly as well. And it would create a restaurant meals program in the state of New York. And that means that those SNAP recipients that are senior, disabled, homeless would be able to use their SNAP card to purchase hot prepared meals at delis or restaurants at concessionary prices, which I think would be a good economic injection to some of our small businesses as well, but also make sure that people who don't have cooking facilities or who can't prepare meals on their own are able to get meals that aren't frozen or canned, and better and healthier options.
Shifting gears here, another question in the chat is people are wondering about pharmacists being able to vaccinate. I know there's a push to get, of course, vaccines out and about in as many locations as possible. Someone's also asking if senior centers should be vaccination locations to continue getting people vaccinated. And I'm seeing some heads nodding there. That seems like an easy answer. Yeah, sure, why not?
You should find every responsible way to vaccinate people.
Anything.
Heck, I would vaccinate people.
I don't care. I'll do even gas stations.
Yeah, our seniors have been the group that actually wanted to be vaccinated the most. So in my district, I'm really happy to say that a lot of my seniors have been vaccinated, and we've used the homebound system as well to get people who couldn't come out their homes vaccinated. So the good thing is that my seniors actually were vaccinated pretty early on.
Mm-hmm.
I'm actually supportive of the issue. I think administering a vaccine is the simplest thing ever. And I think with proper training, of course, a pharmacist could do it. But I just also want to say, during the pandemic, the governor issued executive orders and relaxed some of the scope of practice restrictions for like nurse practitioners. And they have been practicing much more autonomously than they were before. And I think that's key that we look at that and make that permanent, because one of the biggest problems that we see, particularly in the Bronx, is access to primary care. And having nurse practitioners be able to practice more autonomously and provide care in our cities and in our communities, I think is very important in terms of meeting some of those health disparities that we see in places like the Bronx.
Easy for you to say that giving a vaccine is easy as a nurse. I'm a little scared of needles. I don't know if I could do it, but I'm glad that other people are out there. And I did overcome my fear of needles to get the jab a couple times. So I'm glad I did that. We have another good question in the chat about transportation. Many don't think of this particularly as a senior issue, but of course it is. I mean, my gosh, accessible transportation. Are there any current plans that we're interested in the Bronx specifically, or statewide, citywide, involving equitable transportation, getting people moving safely, healthfully?
The buses are how most seniors travel as compared to the subways, and buses are underfunded, particularly in the Bronx. So I think all of us have advocated for a greater emphasis on buses, certainly for more funding. And until that happens, we're going to be put at a disadvantage. The MTA, before the pandemic, had their, I forget what they called it, but their plan to try to, reroute, reconfigure their bus service. But the fact is, I can tell you in my district, bus service is really, it's underfunded. We don't have enough buses. We need to think about the routes that the buses take. And people in the Bronx travel on the buses. I mean, if you want to go east-west, there are no subways. So I think that's one way we should focus our energy. And in terms of the subways, we have to continue to fight to make sure every station is handicap accessible, has an elevator. And it's not just for seniors, by the way. It's for people who have mobility issues. It's for young parents who have to carry a carriage and their kid up and down the steps. So it really has to be accelerated, because right now the MTA plan does not go quickly enough to serve the needs of people throughout the Bronx.
And a lot of the capital plans
that took 10 years for us to get an elevator at the Park Justice station, which has a high number of seniors. MTA ultimately did provide the funding, but a lot of this is just a funding issue, and the MTA refuses to open up their books. They claim that their funding, there's a shortage in funding, there's problems with funding, but we're unable to see it. And I think we're also at the mercy of, to a large extent, of the governor, especially during the budget process. But the way it stands now, bus lines, bus service, and I've worked with transportation alternatives, are wholly inadequate. I can tell you, my Senate district, we get complaints on a regular basis. So we have to do a better job of providing better services. Accessoride, we have to improve that because that's a disaster. But we have to do a better job to provide transportation to our seniors, so they can go out and about without having to wait 4 extra hours for Accessoride, or inconsistent bus timing, or what they call when the buses come bunching, when the buses come in together at one time, and then you don't have another bus for another half hour. So there's a lot of work to be done with the MTA, and it's incumbent upon us as legislators to hold their feet to the fire and continue to push through the budget to get adequate funding for MTA.
I know this topic really, I see that the chat is just blowing up. It really gets people going, talking about transportation. But with just our little time remaining, I do want to give all of our legislators here and Kevin one final chance to say, with the end of session coming up, I think 3 weeks left of legislating time, what is your personal top priority? What would you like to see happen? And I'll start with Assemblymember Septimo there. What's your, and keep it short, like 30 seconds. What are you looking to do?
Well, is this a loose equivalent of 30 seconds or a genuine 30 seconds? Because I got to know. I'm really excited about, I mean, this has been an incredible session. I think, to the point earlier, I would love to see the New York Health Act pass. That would be a dream. But I think, I'm actually really proud of all of the work that's happening legislatively right now. I think we are in this moment where we're sort of in a blank slate coming out of COVID, and we're kind of reimagining, rebuilding the New York that we're going to live in. And the work that we've been doing this session has really prioritized working people, poor communities, Black and Brown communities, in ways that I think we haven't seen in a long time. And I'm really proud to be a part of that. From a personal perspective, personal meaning our district, air quality is always top of mind. And so we're kind of doing some work around that, and I'm excited to keep doing that in this session and hopefully others.
Thanks so much. Assemblymember Dinowitz, top priority.
I have a slew of bills, but I won't go into all of them. I think on the global scale, the New York Health Act, I just put in a new bill, which would make it a felony to sell or buy forged vaccination cards, because that's becoming a national problem with people who don't want to get vaccinated, but they feel that they at least want to be able to show that they're vaccinated, which is really disgusting. And I'm going to try to move that bill. I think it's going to move from our committee, hopefully next week. But there's a long list of priorities. Most of what we get done, and I think all of my colleagues will agree, gets done in the last week or two.
The forged vaccination card definitely fascinated me. That's an interesting.
Isn't that interesting?
Yeah. Assemblymember Reyes, what's your top priority?
Sure. I think, like everyone here, I think globally we're fighting for the New York Health Act and helping to bring it to the finish line. But I have a few pieces of legislation. I've passed some this year that have already become law, but I still have the SNAP benefit, the SNAP bill that we talked about, the opioid settlement fund. And in terms of housing, I've been pushing a bill called HONDA, the Housing Our Neighbors with Dignity Act, which would create a program where HCR can convert distressed hotels and commercial properties into affordable permanent housing for the homeless and for seniors and for low-income folks. We have an appropriation in the state budget of $100 million for it, and we just haven't built out the program. So it is my dearest hope and optimism that we're able to pass this bill. So we build out the program, and we can then determine what happens with that money and not the governor.
I got to talk more about that after this. That sounds like a very, very interesting topic. And Senator Sepulveda, top priority.
All right, I'll give you an Amanda Septimo 30 seconds. One of the things that is ravaging our county is gun violence. And so we're allocating per senator about $50,000 in our districts to combat gun violence, working with programs. But globally, of course, I think we all agree the New York Health Act is important. But, I have, there are other bills. I have a particular bill with Assembly Member Chantel Jackson that is a byproduct of the problems that we're having with bikes that are being put, the bikes, the city bikes that are taking up hundreds of parking spaces in our community. And so we have legislation that's going to give the board, the community boards, a larger say as to where they put these bikes. Because I'm telling you, it's other than housing and food insecurity and unemployment, these issues with bikes taking up spaces is a large problem in our county. So we're going to look forward to
they finally came to your district. Yeah, there you go.
Yes.
And lastly, Kevin Jones, Associate State Director with AARP. Anything at the top of your mind?
I think the biggest priority we have right now is the Secure Choice Savings Program bill, the Savino bill, the Rodriguez bill that already passed the Assembly. So first, thank you to every Assembly member that supported it, and to everyone on this call. I hope you'll not just support the bill, but also reach out to Senate leadership and encourage them to put this on the floor for a vote, because we think this is very important. I also want to thank Senator Biaggi for her pay to delay legislation. For Assembly members, Assemblymember Gottfried has the companion bill, which is Assembly 7245. And the one other thing I want to mention before we close out is that AARP also supports the legislation by Senator Harcum and Assemblymember Epstein to expand accessory dwelling units around New York, which would definitely help with the housing crisis, but is also very, very important for folks that would be able to have an accessory dwelling unit, which would allow them to have family members or other folks. So for family caregivers, it makes their life much easier in terms of arranging housing. So that's Senate Bill 4547 and Assembly Bill 4854.
And sorry, Jeff, I know we're at time, but I would be remiss. I just glanced at the chat and folks are mentioning the fact that education didn't come up.
Right.
I sit on the education committee. It absolutely is critical. We fully funded public schools for the first time in decades, to the tune of $18 million extra dollars coming to my district and billions across New York City. So it is a major priority and we finally funded it accordingly. We do monthly chats with our principals and our teachers in our district, and I'm happy to talk to anyone more about it at any time. Please feel free to reach out.
Yeah, let them know that it wasn't part of our the discussion with AARP, but certainly every member of this panel has a high level of commitment to a better educational system in the Bronx, because to me, that is the root of most of the problems that we have in our county.
Should get its own hour, but of course we are out of time. And look, if you do want to hear more, we're having another City and State's hosting another event with AARP, State Legislative Forum for Long Island, on Thursday at 10 a.m. That's free. You can check out the chat for the link. Coming up the first week of June, we have our Queens Power 100. So for any of you who like driving between the Bronx and Queens, we have an event on Wednesday, June 2nd. That's also free. And later on in June, if you're in the nonprofit world, our sister organization, NYN Media, is hosting OpCon, talking about New York nonprofit operations. So check that out at nynmedia.com. I just want to give a final thank you so much to all of our panelists, those that left, Senator Biaggi and Assemblymember Chantel Jackson, and one still with us, Assemblymember Amanda Septimo, Karines Reyes, Jeff Dinowitz, and Senator Sepulveda, and of course, Kevin Jones, and all of AARP New York. Thank you so much for sponsoring this, helping us put this event together. Again, I'm Jeff Colton from City and State, and thank you so much to all who watched, listened, chatted, talked. This was a great discussion.
Thank you.
Thank you.
Everyone.